Dr. Chol Kim here from sunny San Diego, California. We are getting started, and we have a bit of a VIP. He is a big-time engineer who were the principal people that developed Wi-Fi. Can you imagine a world without Wi-Fi? Anyway, he's got two symptomatic annular tears at 4, 5, and 5, 1, which are confirmed by targeted diagnostic injections. But more importantly, he sent his beautiful girlfriend to have this surgery first, like a test subject, and then he came afterwards after he confirmed that it was a cool idea. I've known him for a long time though, because I did a cervical disc replacement on him many, many moons ago. So either way, I have to do a great job in appreciation for his contributions to the world we live in. Oh, look at that sucker leak out already. Shot and save. Shot and save. You can even see the little crescent behind the needle. Shot and save. Oh yeah. Shot and save. Look at that, it's already leaking straight back. Shot and save. It's official. I still love doing the chromatic discogram, even though it's an extra step. I think these articulating instruments are the way to go. I know it's self-serving since I'm the one who thought of it. But look at how much more capable I am with these things. Otherwise, I have to use the entire scope, move the entire scope, and I can potentially lose the field of view. So now I can move the entire scope and use articulating instruments. Because most of my patients have incredible amount of adhesions due to chronic inflammation. You can't go barreling in here. You have to be delicate, like you're taking gum out of shag carpet. Look how firm things are, where it's more normal, like where it's white. Oh, it's getting emptier. There it is. Yep, look how easy I fall in. If it wasn't empty, it would be a centimeter thick wall of dense collagen. It would take me forever to get through with this. That happens every once in a while. A pimple wanting to pop out and hit the mirror of the bathroom. You know what I'm saying? You know what I'm talking about? Remember those days? Oh, but it's not going to be in one piece, I can tell. Can I have the paprika next? Oh, it's a total cavity right here. There's the tear. Look at that. Look at that. There's something in there wanting to squirt out. Yep, I feel something right here. Yep, there it is. It's so hard to teach this because it's so much feel. Like, how do you know it's there? It's like, I can feel it. It's like, what do you mean you can feel it? It's like, I can feel it. There's like a little snag right there. Granulation tissue associated with the tear right there. That shouldn't be red right there. It should be totally avascular and white. But when you injure something, the scar formation drags in blood vessels. And sometimes it drags in blood vessels with pathologic nerve fibers called C pain fibers that are naked pain fibers. And yeah, that's what causes the pain of inflammation. And for those of you that have ever had rotator cuff tendonitis, plantar fasciitis, tennis elbow or golfer's elbow, you'll know what I'm talking about. You have to admit, if this wasn't blue, it would look really ugly. It would look like snot. Can you imagine if I had a pituitary that was articulating? I think I would just be like done. I'd be like, okay, I don't need one more thing anymore. All right, there was a lot of loose kakapupu disc in there, but not no more. There's the dural tube. And you know what I love? There's a thin layer of fat around it, and you can see where all the blood vessels come from. Look how red it is though. And I bet you it's gonna start pulsating. Yep. And then the ligamentum flavum is still mostly intact. It's going to close up. And get a couple little bleeders. Do a little rhizotomy. Oh, feeling good. One more level. Looking for the empty tent sign. It's not that. It should be where the blue is, theoretically. Oh, there it is. It's not as, there it is. It's not as empty as all the other ones, but if it falls in, yeah, look how hard it is. And it's not empty. Yep, it won't go in if it's not empty. Okay, there's an endoscopic reamer. Isn't it interesting how red it is right there, though? A little suspicious, isn't it? Compared to that. Like right there. And I bet you right here is going to be white. Well, I don't want to strip it of its blood supply. That would be barbaric. Oh, I feel so good. Okay, surgery's all done. One little stitch and then the skin glue. And here's the thing. When you apply the skin glue, you have to wait for it to dry. Every time you touch it to see if it's dry, if it's not dry, it starts to cycle all over again. So I used to get so frustrated because I'm impatient around now. But a really smart anesthesiologist by the name of Dr. C said, why don't you create a little test area, touch that, and when that's dry, then touch that. That way you don't do that. And I'm like, that's a genius idea. And he's a pretty smart cookie. That's not the only thing. And your surgery went absolutely beautifully. We're all expecting a great result and praying for a speedy recovery, so best wishes.